Hello, everybody on YouTube. Um, this is January 26th, 2010. This is going to be my second YouTube video for today. So kind of making up for the other ones. But I had thought of some things that I wanted to say. And they pertain to the what's been preoccupying this country for about a year, and that's healthcare. And I find it amazing that one of the things that was good, though, that there was definitely a lot of discussion about healthcare by the people. There were many different ideas that came out to that we could use, that we could implement. And I mean, if entrepreneurs, good savvy entrepreneurs, were to be listening to this, I could see a bunch of business opportunities. Of course, if I had the capital, I could actually bring in some of these business ideas. But since I don't have the capital, all I can do is just make this YouTube video. And maybe that would be inspiration for somebody else. Now, I have been going to a place, and I posted about this on my blog over at becomingtogether.blogspot.com. www.becoming.us, I think it is. Anyways, becomingtogether.blogspot.com. You'll get there. And posted it some time ago, so you'd have to look in the archives, probably in 2009. But I mentioned an organization that is here in Manchester, New Hampshire, and we need more organizations like this. The organization is Manchester Community Health Center. And what they do, they help the uninsured to get health care. Not just critical care, but regular ongoing care that keeps them out of the emergency. Because before, places like Manchester Community Health, the only thing we could go to was the emergency room. But because of Manchester Community Health and their pay structure, is based on a sliding scale, based upon your income. You make more, you pay more. And since probably 80% of the jobs in Manchester are low-income jobs, it comes in handy. And they also partner up with one of the hospitals we have in the area, the Elliott. But it helps divert the cost of healthcare and spreads it out. I mean, I still think that the major solution to our healthcare would be to either the doctors and hospitals to lower their cost, or for areas like in Manchester, and I'm sure there are other areas around the country, to get higher paying work. Instead of having businesses go overseas for all the high paying jobs, if businesses could stay in the United States and do the high-paying jobs. course, if they stayed in the United States with the high-paying jobs, the government will have to put their 2 cents in and make them, make their lives miserable, with a bunch of things they got to pay. Even though I have done independent contracting jobs, and I know some independent contractors. When you file taxes from a independent contracting job, you get to write off a lot, and that helps out, but doesn't always help. First of all, it's also very confusing, and you need a lot of paperwork to actually file instead of making the whole process easier. Anyways, those are just some of my thoughts on that, and I wanted to talk about a little bit about diabetes, but since this is about 6 minutes, that will have to be another video. So stay tuned for that video. Stay creative in the magic of life. And as Chris Perillo says over at lockanome.com and YouTube channel, I think it's Lockanome of Chris Perillo. You later. Have a good